This concept of shelter in place is not something that we are very familiar with unless we are practicing.
We love being on stage and bringing joy to the community. But right now, the best thing we can all do is stay inside.
And the most important harmony that we can create
is unifying together to shelter in place.
The sooner we beat this thing, the sooner we're back on stage bringing music to the crowds.
And if we can do it, so can you. Let's beat this together.
This is a message from the government of Bermuda.
Today, I'm joined by the Minister of National Security, the Honorable Wayne Keynes, the Minister of Health, the Honorable Kim Wilson, and the Chief Medical Officer, Dr. Cheryl Peake-Ball. Before I get to my substantive remarks today, I would like the Minister of Health to please give an update on the latest testing statistics for Bermuda and also other issues related to the management of this virus. Minister?
Between yesterday and today, there were 636 test results received by the Ministry of Health, and one was positive for COVID-19. Bermuda now has recorded 111 total confirmed positive cases. Their status is as follows. There are 57 active cases, of which 43 persons are under active public health monitoring and 14 persons are hospitalized. A total of 48 persons have now recovered, and the total deceased remains at 6. The average age of all of our confirmed positive cases is 59, and the age range of all positive cases is from 18 to 95 years. The age of persons hospitalized ranges between 57 and 91 years, and the average age is 75. Overall, Bermuda has now conducted over 2,000 tests, which gives us confidence that our status remains at local transmission with clusters of cases. We do not have widespread community transmission, which will give us all relief. Our suppression measures are showing success and are working. As of today, we have tested 118 care home residents and 149 staff members from 5 different care facilities. Of these, 226 have come back negative and 41 positive. Of the total number of positive tests at care homes, 22 were asymptomatic individuals. In addition, the residents and staff of Matilda Smith Williams were retested following initial testing, which occurred 2 weeks ago. We retested because there was the outbreak, as we've reported, at the home. We needed to retest all patients and staff in order to determine if anyone had transitioned to positive and how to appropriately staff the home in light of staff and residents' COVID-19 status. Since the original testing, we had asymptomatic but positive staff caring for positive elders and negative staff caring for negative elders. Of course, all of them have been using full PPE regardless of their status. Retesting helps us to better decide how to integrate individuals. Additionally, some who underwent the initial process of screening may have had no symptoms, had a low viral load, and therefore may not have been identified as positive at that time. This second screening will catch anyone who may have transitioned to positive. As I mentioned previously, testing is just one measure that we use to stop the spread of COVID-19. Another very important mitigation measure is contact tracing. Therefore, we have steadily increased our capacity for contact tracing. Staff from various other areas in the government have been enlisted to assist in this regard, and we now have 6 groups of 5 contact tracers. Furthermore, we are looking to train some additional essential workers to contact trace. It is also important to remember that a negative test result tells you your status at a specific point in time. It does not mean that you are immune. It does not mean to stop washing your hands or wearing a mask. It means that right now you do not have an infection, but you still have to take all of the precautionary measures to ensure that you do not contract it in the future. On another positive note, My staff have reported that our new non-contact thermometers, which arrived last week, have been excellent and are much easier and quicker to use than the ones that they were previously using. As we expand on testing to support the island getting back to work, Helix Lab and BGMD Lab are in the process of implementing antibody testing, which will be online shortly. Regarding those who are in the government quarantine facility, this week we are implementing a new over-the-phone mental health screening tool to monitor and ensure their well-being. The calls are made by nurses from the Ministry of Health who will reach out to the Mid-Atlantic Wellness Institute if they identify someone as needing help. We recognize that some may find the quarantine experience traumatic and stressful, and we want to assist where we can in this regard. As shortly, we will be slowly and gradually beginning a phased reopening, but the Premier will provide more details of what that looks like and the parameters and all the particulars in a few moments. However, it is absolutely clear and essential for everyone to understand that this is not a return to normal pre-COVID life. In fact, the world and Bermuda will not experience life as normal for the foreseeable future. As we enter in the next stages, all of us will have to continue stringent physical distancing measures to avoid returning to a shelter-in-place scenario. Please remember, as soon as the rate of transmission goes up or hospitalizations start to increase, restrictions will be needed again. So everyone's adherence to physical distancing requirements will be fundamental for our survival. The physical distancing requirements have been broadly circulated and include wearing face masks in public, particularly in grocery stores, pharmacies, gas stations, and anywhere where you are in close proximity to others, practicing physical and social distancing, which means leaving at least 6 feet between you and others, and practicing respiratory hygiene, such as covering your coughs and washing your hands often with soap and water for at least 20 seconds, or in the absence of soap and water, use hand sanitizer. Remember, I wear a mask to protect you, and you wear a mask to protect me. I don't want to sound like a broken record, but I have to restate that health will recommend the reinstatement of suppression measures if trigger points such as increased hospitalization admissions or increased cases are identified. Lastly, as we prepare for the next phase of our level of preparedness with respect to sheltering in place, we need to remember that there are members of the community for whom it is still not safe for them to leave their homes. These are our vulnerable populations, people who are at higher risk of severe illness from COVID-19. These people include people undergoing cancer treatment, people who have had organ transplants, people with severe respiratory conditions, women who are pregnant, people who are severely obese with a BMI index of over 40, and people with poorly controlled chronic conditions such as heart disease and diabetes. If you or someone that you know has any one of those conditions, then you need to help to protect yourself from exposure of the virus by continuing to shelter in place. And I know it's hard, but please continue to stay home. Likewise, if you know anyone with any of these conditions, whether it's a friend or a family member or some other member of the community or a neighbor, please ensure that you help them to shield them as well from potential infection by assisting them in any way possible so that they can continue to stay at home, to be protected, and do not need to go out for any other reasons. The shielding measures must be taken by vulnerable individuals, and they are: stay home at all times. This means no trips to the grocery store or the pharmacy. Ask a friend, a neighbor, or a family member to bring you supplies where possible, or use delivery services if you can. Most pharmacies on island are offering a delivery service, so you can contact your local pharmacy to make those inquiries. Minimize all non-essential contact with other members of your household. Avoid any face-to-face contact and strictly avoid contact with someone who is displaying symptoms of coronavirus, which include high temperature and new or continuous cough, and do not attend any social gatherings. Visits from those who provide essential support to you should continue. However, caregiving and healthcare professionals should stay away if they have any symptoms at all of COVID-19. And all people entering into your home should wash their hands with soap and water for at least 20 seconds on arrival to your home and often while they remain in your home. And all of this advice can be found on the website at coronavirus.gov.bm. Thank you, Premier.
Thank you very much, Minister of Health, for that excellent report. And certainly, I think that we're all gratified to hear the news from the Ministry of Health regarding the fact that we have managed to, in their estimation, get us to a point where we did not reach a place of sustained community transmission, and we still have local transmission with a cluster of cases. And that is certainly, in no small measure, not only to the work of the team at the Ministry of Health, but the work of all of the government officials, and certainly our Bermudians who obeyed the rules. To borrow a phrase that has become popular in this pandemic response, we have come to the end of the beginning. As I indicated when we started the last 2 weeks of shelter in place, this period will end on Saturday morning, May 2nd. This has been a period of change in how we live, socialize, worship, and work. Whatever we have achieved from a public health perspective is because of public compliance. The people of Bermuda have listened and taken on board the significance of this threat, and we have together done what was necessary to protect the most vulnerable and to ensure that our healthcare system can cope with the additional demands for its services. In a marathon session yesterday, Cabinet discussed and considered each and every aspect of how we can best transition into the next phases of this pandemic response. Decisions were informed by presentations from the Ministry of Health and detailed public health advice about how to continue to mitigate the risk of any community spread of this virus while attempting to breathe additional life into this economy and to provide some emotional relief to people who have complied with the demands of this ongoing fight against COVID-19. The decision to end shelter in place was not made without scientific advice. And the change in the manner of which we should go about our daily lives should not be seen as a radical departure from the measures that we put in place to suppress the change of this virus. Social or physical distancing is more than just words. It is key to our survival, and it will have to be our new normal, and it will not change for the foreseeable future. We must get Bermuda working again. We must get Bermuda enjoying life again, but we must also be mindful that we cannot and will not place the health and safety of our senior citizens in jeopardy. We have adopted a strategy for a phased reopening of our economy. These 4 phases set out how we will progress through this ongoing pandemic response. It is important to note that there are no dates attached to phases 2, 3, and 4. This is because how we progress is directly dependent on how well we comply and how we see our hospital and population being affected. That means that the more we have compliance with the rules that are laid out in a particular phase, and we keep transmission of the virus at bay, the quicker that we can move to subsequent phases. We must remain flexible on these matters because the lesson of other countries is that we must always be on guard for any new assaults or second waves of this virus. So, what I know all of you want to hear, this is what you can expect with phase 1, which begins on Saturday morning at 6 a.m. With some modifications, we will essentially be returning to where we were on April 3rd, before the shelter in place was established. Shelter in place will end, meaning that it will no longer be illegal to visit another household. However, it is strongly encouraged that persons do not visit other households, especially, as the Minister of Health said, households with vulnerable persons. A curfew will remain in place between the hours of 10 p.m. and 6 a.m. Gatherings will be limited to no more than 10 people. Retail businesses and restaurants will be permitted to open between the hours of 7 a.m. and 9 p.m. with only curbside service or home delivery. It is important to note that even with the end of shelter in place, businesses outside of those that will be able to operate, such as retail and restaurants, still are subject to the mandatory work from home provisions inside of the law, and those businesses must remain closed if employees cannot work from home. Grocery stores and gas stations will remain open under the current conditions, and days of shopping will continue to be prescribed so that stores are not overwhelmed. Construction, mechanical, and landscaping services can reopen with strict social distancing. Guidance will be released, and any business or job site not adhering to that guidance will be closed. Wholesalers will be open with social distancing to deliver food and supplies as they were now. Funeral services will be permitted with strict social distancing and a maximum of 10 persons indoors or outdoors. The public service will continue to work remotely, but limited cashier counter services will reopen on Monday, May 4th for such areas as TCD, the Office of the Tax Commissioner, and the cashiers on the ground floor of the Government Administration Building and at the Dame Lois Brown Evans Building. As more counter services or front-facing services come online, they will be announced. The courts will open and will operate with appropriate social distancing. Banks will be permitted to operate with minimum operations and social distancing. Trash collection will continue, and I'm pleased to advise that public drop-offs at Tynes Bay will be open on Saturday. Laundromats will continue to operate under the current restrictions, and that is important to note because prior to the shelter in place, they were not those restrictions in place. However, they will be permitted to operate only between the hours of 7 a.m. to 9 p.m. As is now, only one customer or family will be allowed in the laundromat at any one time by appointment only, and wash and fold services may be provided as long as customers do not enter the premises during the drop-off or collection of their laundry. Parks, beaches, the railway trails, and golf courses will reopen. However, golf clubs and any sporting club building will remain closed, and all activities will have to follow. Schools at this time will remain closed. Prison visits will remain restricted as they are currently. Church buildings will remain closed. Gyms, bars, salons, spas, and barbershops will monitoring is prepared to adjust these regulations swiftly if circumstances stay home, move only when you need increase in Bermuda's testing capacity over the past week has given us the confidence to permit the changes